Swasthya Sati Free Health Checkup Camp. This camp is being conducted in collaboration with Fortis Hospital, who have kindly come forward to extend their expert medical services to us. The objective of this initiative is simple: to spread awareness about preventive healthcare and to encourage everyone to take proactive steps towards a healthy lifestyle. I would first like to introduce you all to the institute. Geeta Ratan International Business School, an institution that prides itself on empowering students with knowledge, skills and platforms to excel. Established in year 2004, GIBS is affiliated with Guru Gobind Singh Indraprasth University, Delhi, and is approved by All India Council for Technical Education and the Bar Council of India for its law program. The institute offers a variety of courses including MBA, MBA International Business, MBA Integrated, BBA Honours, Integrated BA LLB Honours, BBA LLB Honours and LLM. To lead the session, we are pleased to have with us Dr. Suhail Qureshi. We are honored to welcome Dr. Suhail Qureshi, an eminent medical oncologist with over 14 years of experience in the field of oncology. He completed his MBBS from Bharati Vidyapeeth Medical College, Pune, followed by DNB in Medicine from Safdarjung Hospital and BMCC, New Delhi. His passion for oncology led him to pursue a fellowship in medical oncology, hematology and bone marrow transplantation from Vedanta, and later a super speciality DNB in medical oncology from Dr. B.N. Kapoor Memorial Hospital. Dr. Qureshi currently serves as an additional director and unit head of medical oncology at Fortis Hospital. He has numerous national level publications, presentations and has contributed chapters to oncology clinic. We extend a warm welcome to you, sir. Now I would like to invite our program coordinator, Muskan ma'am and Prerna ma'am for presenting a plant sapling to our guests as a gesture of gratitude. With utmost respect and heartfelt admiration, I now invite Dr. Suhail Qureshi to grace the stage and enlighten with his words.
Good morning and thank you very much. Can you hear me? So first of all, very good morning to all of you, and I would like to extend my heartfelt gratitude to Muskan ma'am, Prerna ma'am, Weber for introducing me so generously, and to all of you for being present here today in the morning, taking time out from your precious schedule of your classes and this awareness activity for oncology here today. So my heartfelt gratitude from my organization that I represent, Fortis Hospital, Shalimar Bagh. And today we are here to talk about a subject that is considered taboo, जिससे हम लोग अक्सर डरते हैं, and something that somehow has become so commonplace these days that आज से 20 साल पहले we did not used to talk about cancer in the same manner and in the same way that we talk about today. And therefore it is all the more important to remain aware of what this disease entails and what exactly we need to know to make ourselves aware of the basics of this disease. We all have seen two very dark years of humanity during the COVID era, when we lost a large section of humanity to coronavirus epidemic or the pandemic, if I say so. And during those 2 years, we got acquainted with a virus that we perhaps were not even aware of that it even existed before it became such commonplace. Cancer is the epidemic of the 21st century that consumes lives in the same manner that COVID did for the 2 years. And therefore, we all must know and make ourselves aware of what this disease actually is and how we should go about fighting it. So, how can I Yeah. Operate. Am I visible without the mic? People at the lab.
So somebody from the volunteer will change the screen if it's okay?
It's okay. I prefer it to be like that. Yes, we can go back to the first slide. Very first slide. First of all, this presentation is going to be an interactive presentation where I'm going to ask you questions. These questions will not hold any marks for your internal assessment, so you don't have to be worried about it. Okay, I know that many of you are smart kids of 21st generation, 21st century. Your knowledge of cancer will be far more than my knowledge of business. So let us keep it very interactive amongst ourselves. So what do you see on the screen? Anybody just raise your hand and tell me what is it that you see here? 1963, humble beginnings of what? What is it? Anybody just raise your hand and tell me. Yes, tell me. Green revolution. No. Anything else? There's nothing green over here. You see there's a bullock cart and there's something being loaded on the bullock cart. Anybody else? Good answer. What's your name? Rhythm. So a very good answer from Rhythm. So 1963, this slide shows us the beginning of India's space program. Okay. So in 1963, from a small village called Thumba near Thiruvananthapuram, India launched its very first satellite called Apache 4. And this was launched with the help of USA's collaboration. At that time, we did not have the technology to transport the satellite parts to the launching station. And we launched these, had these parts of the satellite loaded on a bullock cart, and some of them were loaded on bicycles. And the two stalwarts of India's space program, Dr. Vikram Sarabhai and his protege, his student. Anybody knows the name of student? These two were instrumental in giving shape to India's space program and launching India's first satellite in space in 1963. That brings me to this image almost 60 years later. Anybody knows what that is? Very good. Our very own Chandrayaan. 60 years later, India became the first nation to land its spacecraft on the southern pole of the moon. And that was the image of 21st generation aspirational India, that India will stop short of nothing less than the moon and the stars. And today's generation says, "Mujhko chand la ke do." So that is the journey of India's space program from 1963 to 2023. And see the rapid strides we have made in space. Anybody tell me 1975, what is this? No, that is not the Mars rover. 1975. Anyone else? I heard it from somewhere here. Is it something? First artificial satellite. Yeah, what is it? First, India's first satellite that we made on our own self indigenously and launched in space in 1975. Our very own Aryabhat. And this was launched from, or I can hear that this was almost ready to say the answer. So अगर डर लगता है कोई बात नहीं, गलत भी बोलो चलेगा. So it's an informal session. So 1975, India made its own satellite, the Aryabhat, and we launched in space from a Russian space station. So why am I talking about space science when I'm going to talk about oncology? The reason is, I want to draw parallels. So hold that thought कि हम 1963 में कहाँ थे and 2023 में कहाँ पहुँचे. This is when 1975 we were launching the Aryabhat. This is what the scientists knew about the cancer cell. एक कैंसर सेल होता है जिसमें एक न्यूक्लियस होता है, एक साइटोप्लाज्म होता है, और उसके अलावा we did not know how this cancer cell looks from the inside. What are the targets? How can we devise newer drugs so as to target this cancer cell more efficiently? So imagine where we were in 1963, loading satellites on bullock carts and taking them to the launch station, to 2023 when we landed on the moon. This is how the journey in cancer has traveled from 1975, and this is what the cancer cell looks like in 2023. This is the cancer cell today, full of different targets, full of molecular pathways, full of different signals which we can exploit for the treatment of cancer. And this is where our understanding of cancer has traveled from 1963 to 2023 today. And that is what we know of cancer today and how effectively we can treat cancer in this 21st generation, 21st century. So the very first myth that I want to debunk over here is cancer a death sentence in the 21st century? The answer is an emphatic no. It is not the same disease that we knew 60 years back, and today there are far more efficient ways of treating cancer than what we knew back in the 1960s or 70s. So today, in 21st century, cancer is treated by something that we call as targeted therapy. So what exactly is a target? So just moving to one direction. We treat cancer by an approach called targeted therapy. So what is targeted therapy? In a targeted cancer therapy, we identify a particular target on the cancer cell or inside the cancer cell, and we use certain techniques to attack or inhibit that particular pathway or that particular target so as to only kill the cancer cells in the body without affecting the normal cells. How do we identify such a target? So sometimes we do molecular testing of this cancer cell in the laboratory, and we identify any protein on the surface of the cancer cell or a pathway that works inside the cancer cell, which can be specifically targeted so as to kill only that cell without affecting the normal cells of the body. Most of our cancers today, whether it's breast cancer or lung cancer, have a multitude of targets that can be identified, and those cancers can be treated in a targeted precision oncology manner. So this is the power of targeted therapy. This is a young lady. She came to us in the emergency in July 2022. You can see all this in the lung is cancer. This yellow part that is lighting up, that is all cancer. And she had cancer deposits on the left lung also. And she came actually out of breath, on an oxygen. She had two small children. Her elder one was in 8th standard. Her younger one was in 6th standard. She had two small kids. And she had this kind of a picture in the emergency, hardly able to breathe. When we took a biopsy from the lung and we sent it for testing, we found that her lung tumor had a particular mutation which is called a RET mutation, R-E-T, RET mutation. Now this mutation is found in almost 0.5 to 1% of cancers in the lung. Thankfully, this cancer does not require to be treated by chemotherapy. A simple oral tablet called sulfatinib is enough to treat this particular cancer. Mind you, this was a stage 4 last stage cancer, which if diagnosed back in the 1960s, she would not have lived for more than 6 months. Unfortunately, this medicine was not available in India. Abhi ko India mein nahi aati. So we wrote to the company that manufactures this drug in the US, and we asked them that can this medicine be made available to our patient in India on a compassionate ground, because this medicine is not available in India. They made us do some paperwork, fill up some forms, get the clearance from Customs Department of the airport in India, and we filled up those forms to get this drug free of cost for that patient, which actually cost in lakhs. So the company was kind enough to send us this tablet. It took 2.5 to 3 months. During that time, we treated this patient with chemotherapy, the conventional old-style chemotherapy, and tried to control the disease. When that medicine became available, we gave this medicine to the patient, and she responded beautifully to that drug. So much so that just 1 month or 10 months down the line, this is what you see in the CT scan of this patient. That cancer has completely disappeared. And today, as I speak here in August of 2025, our elder son is going to give class 12 board exams next year, and she's doing very well for herself in a stage 4 cancer, surviving for almost 4 years and still doing very well and very healthy. That is the power of targeted therapy. The same patient's images, you see almost this lung is completely distorted by cancer, and you can see some cancer deposits in the other lung as well. That is July of 2022. This is 2 years back. As of today, she has no evidence of cancer in her body. So there are various drugs that are available, which are the poster boys of targeted therapy. This is one of them. This is an injection which attacks a particular target on our B cells called CD20. This injection is called rituximab. These drugs are used to treat blood cancers in a very targeted fashion. Another myth that is always propagated in the community is cancer always hereditary? क्या कैंसर हमेशा वंशानुगत होता है, आनुवांशिक होता है? Is that so? Have you heard of some cancers which are hereditary? Anybody? Anybody? Have you heard of cancers which are hereditary, which run in families, which are inherited from the mother to the children, or from the father to the children? Anybody? So lung cancer is not hereditary. But anyone else? Blood cancer? No, not really. Anyone else? A very common cancer in India? Breast cancer, yes, very much. So ये तो सब लोग जानते होंगे. Who is this lady on the board? Anyone else? Anybody नाम लिखा हुआ है यार? The boys, I expected more from you. Okay. So Hollywood actresses, one of the most popular actresses from Hollywood, Angelina Jolie. Anybody knows why she was featured on the cover of Time magazine in May 2013? Anybody? Very good. Did she have breast cancer? No. She did not have breast cancer. Anybody who knows the Angelina story? And what exactly am I referring to when I say the Angelina effect? Okay, so I'll tell you. Angelina Jolie ki nani had some problem in her early adulthood, and she died at a young age. Us time pe Angelina was very small. She did not know what really happened to her. Angelina Jolie lost her mother to ovarian cancer at the age of 54. Angelina Jolie's Masi also had some problem that she was not aware of, and she also died at a young age. So when genetic testing became available in the US around 2008 or 10 की बात है, तो एंजेलिना जॉली ने अपने एक डॉक्टर से बात करी एंड शी आस्क्ड हिम कि मेरी फैमिली में ये हिस्ट्री है, मेरी मदर की 54 इयर्स की एज पे ओवेरियन कैंसर से डेथ हुई, मेरी नानी को भी कोई प्रॉब्लम थी, सो व्हाट शुड आई डू? सो उनके डॉक्टर ने उनको एक जेनेटिक टेस्ट करने के लिए बोला जिसमें सिंपल या तो ब्लड टेस्ट या चीक स्वाब, जैसे हम कोविड के टाइम पे थ्रोट स्वाब देते थे, ऐसे ही चीक का स्वाब लिया जाता है. तो या तो चीक स्वाब या ब्लड टेस्ट उनका कराया और उससे उनके जेनेटिक एनालिसिस किया. And Angelina Jolie was detected to have a genetic mutation in a gene called BRCA, BRCA, breast-related cancer antigen. उसके दो genes होते हैं, BRCA1 and BRCA2. So Angelina Jolie had a defect in one of these genes. Till then, she had not got the cancer. So उसने डॉक्टर से कहा कि probably इसी जीन की वजह से मेरी मदर को भी प्रॉब्लम हुई, मेरी नानी को भी प्रॉब्लम थी. What should I do? अभी तक तो मुझे कैंसर हुआ नहीं है, but what are my chances? So अगर किसी पर्सन को BRCA1 का जीन का म्यूटेशन हो, that person has an 8 times greater risk of developing breast cancer than a normal individual. अगर उस बंदे को BRCA1 या BRCA2 म्यूटेशन हो, तो उसको 7 times greater risk है ओवेरियन कैंसर होने का than a normal individual. And let me tell you, it is not just the females who will suffer from it. Even males who have this gene in their blood can also get breast cancer. Breast is also present in males, but it is biologically less well developed because females think the breast has to perform a biological function of feeding the young child. Males don't have to perform that biological function, but breast male का भी होता है. So if a male is carrying that defective gene, then male breast cancer can also happen. And that same gene can cause prostate cancer, which is found in males. So breast and ovarian cancer in females, breast and prostate cancer in males. In both sexes, it can cause stomach cancer also, It can also cause pancreatic cancer and in rare instances brain tumors. So that was the gene that Angelina Jolie was carrying, and she was virtually sitting on a ticking time bomb. So she asked her doctor कि मैं करूँ क्या? मैं अपना जीन तो हटा नहीं सकती. When you are born with a certain set of genes, जो आधे आपके फादर से आपको मिले हैं और आधे आपकी मदर से आपको मिले हैं, आप उसे बदल नहीं सकते. So what should we do? So her doctor told her that if you have completed your family, then you take out both your ovaries and fallopian tubes. And if you want to reduce the risk of your breast cancer, then you remove your both breasts surgically. It's a very difficult decision for any female to take. More so an actress who thrives in showbiz, where everything is dependent on your bodily image and your persona. But in 2013, Angelina Jolie took that brave and courageous step of getting both her breasts surgically removed and getting plastic surgery done for both the breasts. She had completed her family, and therefore she also decided to remove both the ovaries and fallopian tubes so as to reduce the chances of this cancer happening. Mind you, I'm saying reduce. I'm not saying completely eliminate. Even after removing both the breasts, the chances of reduction of the cancer risk is 80%, not a full 100%, because some amount of breast tissue will always remain in your armpits. Similarly, when you remove the ovaries, the chances of risk reduction of the cancer comes to around 60%. Again, not 100%, because the outer surface of the ovaries is in a continuous lining with the inner lining of our abdomen. You cannot remove the inner lining of the abdomen. So you can still get a cancer of the inner lining of the abdomen, which is called primary peritoneal cancer. But the more important organ where the cancer usually arises is the ovary. So 60% chances of ovarian cancer are reduced by getting the ovary removed. So for taking this one courageous step, अगर 1000 डॉक्टर एक साल तक चिल्लाते रहते कि ये जेनेटिक टेस्टिंग कराओ, अपने ब्रका म्यूटेशन वाले पेशेंट्स को ब्रेस्ट रिमूव कराने के लिए बोलो, ओवेरियन कैंसर अगर किसी को हाई रिस्क है, ब्रका म्यूटेशन है और फैमिली पूरी हो गई है तो ओवरीज रिमूव करने के लिए बोलो. 1000 डॉक्टर एक साल तक चिल्लाते रहते, किसी के ऊपर कोई फर्क नहीं होता. But just because a famous celebrity who had that defective gene took that brave and courageous step, this became the knowledge which everybody knew. And for that one bold step, she was featured on the Time magazine in May 2013. And I will tell you what this Angelina effect actually means. This is what she did. 40 publications in the next 15 days documenting a pivotal change in the behavior of people. जो लोगों को टेस्ट कराते cancer, increase in doctors' referral for testing the patients for this particular gene, increase in self-funded BRCA testing. अमेरिका में सब कुछ सरकार करती है, तब तक सरकार इसके पैसे नहीं देती थी. लोगों ने अपनी जेब से टेस्ट कराना शुरू कर दिया, जो कि कई हजार डॉलर्स का था. 64% increase in the testing of BRCA in the next 15 days after this editorial was published. An increased option for bilateral mastectomies as prevention in both carriers and non-carriers. लोगों के दिल में जब एंजेलिना जोली ने ये डिसीजन लिया, उनके मन से वो झिझक हट गई. And more people came forward for getting the breast removed if they had that particular genetic mutation. So that is what we call the Angelina effect. Okay, so time for playing question answer once again. Anybody knows who are these two gentlemen? Just raise your hands and tell me. Who's that? Ex-Chief Minister of Goa and ex-Defense Minister of India. Name? आपने उसका डेजिग्नेशन बता दिया, नाम नहीं बताया. मनोहर पारिकर, India's Defense Minister, and this gentleman on the right, Steve Jobs, the founder of Apple. So what is the common feature between these two? Anyone? Anybody? Pancreatic cancer. Both of these gentlemen succumbed to pancreatic cancer. Steve Jobs बड़ी इंटरेस्टिंग स्टोरी है. 2003 में स्टीव जॉब्स को पैंक्रियाज में एक गांठ मिली उनके रूटीन टेस्टिंग में. जब उसकी टेस्टिंग की गई तो उसमें कैंसर पाया गया. उनसे कहा पैंक्रियाज को निकलवा दो, ये सर्जरी से अर्ली स्टेज में ठीक हो जाएगा. बट स्टीव जॉब्स ने उस समय नेचुरोपैथी, ऑल्टरनेटिव मेडिसिन और इन सब तरीकों का सहारा लिया और उन्होंने पैनक्रियास की सर्जरी नहीं करवाई, जो बाद में उन्होंने अपनी किताब में लिखा कि मैंने गलत किया। By the end of 2005, that cancer had spread to the rest of his body and it could no longer be cured. Till about his death in 2011 or 12, he fought a brave battle with cancer, he eventually succumbed to cancer. But उस दौरान इन्होंने हमें 2007 में Apple iPhone दिया, iPad दिया, MacBook दिया और आज आप बहुत सारे इलेक्ट्रॉनिक डिवाइसेस जो Apple की यूज़ करते हो, उसका फाउंडर स्टीव जॉब्स। Unfortunately, we lost him to pancreatic cancer. अगर उस समय 2003 में स्टीव जॉब्स समय रहते अपनी वो सर्जरी करा देते, who knows how long we may have lived. That is the importance of early detection of any cancer. Because अगर आप early detect करते हो, आप उसे cure कर सकते हो. Okay? Anybody else? Who are these gentlemen? Nelson Mandela. Come on, boys. James Bond, the longest serving James Bond, जिसने सबसे ज़्यादा James Bond मूवीज में काम किया है, who's that? Roger Moore. This fellow, Oscar winner, and he's a very famous American TV personality, grandly patented. Who's he? So let's move. इनके बीच में कॉमन लिंक क्या है? नेल्सन मंडेला, मैंडी पेटिंगटन, रॉजर मूर, क्या कॉमन क्या है सब? Which cancer connects all of them? And I'll add one more person to this list. India's very own first superstar, Dilip Kumar Sir. Prostate cancer. So again, we are talking about BRCA. So as I told you, अगर किसी को जनरल पॉपुलेशन की मैं बात करूं, तो अगर किसी को इंडिया में कोई जेनेटिक म्यूटेशन नहीं है, तो इंडिया में 5 से 8% जनरल पॉपुलेशन को ब्रेस्ट कैंसर का रिस्क होता है। कुछ लोग 12% पॉपुलेशन में कहते हैं। और अगर किसी को BRCA1 का म्यूटेशन हो, तो उस पेशेंट को 50-80% चांस है ब्रेस्ट कैंसर होने का। अगर किसी को ओवेरियन कैंसर कम्युनिटी में 1-2% होता है, तो BRCA1 जीन होने से 40% चांस है ये कैंसर होने का। ओबीसी मेल ब्रेस्ट कैंसर का इंसिडेंस जनरल पॉपुलेशन में केवल 0.1% है। इट जंप्स टू 2% और 10% विद BRCA2। So this is actually the table which is telling you कि BRCA1 and BRCA2 के जीन के होने से अलग-अलग कैंसर का रिस्क उन लोगों के लिए कितना बढ़ जाता है। But now, सिर्फ risk reduction करना हमारा काम नहीं है. Today we also have tablets which actually work in those patients जिनको ये BRCA म्यूटेशन है और ये स्पेसिफिकली जाके उन सेल्स को मारती है जो कि ये BRCA म्यूटेशन कैरी करते हैं और हमारे उन सेल्स को दोबारा कैंसर के बनने में एंड कैंसर के रिकरेंस के होने में कम करते हैं, चांसेस को प्रिवेंट करते हैं. बट ये अगर किसी को BRCA म्यूटेशन हो तो उसके लिए नहीं है. अगर किसी को एक बार कैंसर हो जाए तो उसके बाद उससे प्रिवेंशन के लिए these tablets can be given to them, not just to any individual जिसको सिर्फ BRCA मिले. They are not substitutes for risk reduction surgeries or risk reduction ovarian removal. They are given to patients after they have been diagnosed with that cancer, and if they have to take these tablets to prevent the chances of that cancer coming back in that patient. So I've already told you that over the years, this tablet, olaparib, has been tested in 4 different tumors, and the safety profile is fairly well tolerated amongst even Indian patients. Again, two very well-known individuals. Anybody knows? These two? Vinod Khanna and Feroz Khan. Wonderful answer. What's your name? Arpit is very well aware of his general knowledge, and his general awareness is very good. He identified Manohar Parikar, identified both these gentlemen. So Arpit, tell me between the two different cancers. Okay. So Vinod Khanna died of cancer of the urinary bladder, and Feroz Khan died of lung cancer. He was a heavy smoker and he died of lung cancer. So now hold this thought. I'm talking about lung cancer and I'm talking about urinary bladder cancer. Both these gentlemen actually starred in a very famous Bollywood movie in the 1980s, Qurbani, won the Filmfare Award. This gentleman, anybody, you can see the US flag in the background. US President. The longest living US President died just 2 months back. Died at the age of 101 years old. I heard this name from somewhere here. Anybody at the back? अरे 2 महीने पहले डेथ हुई है यार. So Jimmy Carter, okay, President of the USA in the 1980s, died recently at the age of 101. What cancer did he have? So Jimmy Carter को 2014 में एक स्किन कैंसर से डायग्नोस किया गया, जिसको कहते हैं मेलानोमा. इंडिया में लेस कॉमन है, ऑस्ट्रेलिया, न्यूजीलैंड, यूएसए, कनाडा इसमें काफी कॉमन है, जहाँ पे अल्ट्रावायलेट रेज का एक्सपोजर इंडिया से ज्यादा है. So I talked about lung cancer, Feroz Khan, bladder cancer, Vinod Khanna, and I'm talking about skin cancer, Jimmy Carter, and our very own Munna Bhai, which cancer? So not prostate. Again lung cancer. Who said lung cancer? Good answer. What's your name? Aditya, very good. Zyada लड़के आंसर करें, no one girls. Apart from rhythm, I don't see any girls answering. Anyway, so Sanjay Dutt, our very own Munna Bhai, he also had lung cancer and stage 4 lung cancer. Jimmy Carter को 2014 में जब melanoma यानी skin cancer डिटेक्ट हुआ, it had already traveled to his brain. और ब्रेन में अगर कैंसर पहुंच जाता है, तो आपका सर्वाइवल कम हो जाता है. It is counted in weeks to months. barring a few exceptions. So उस टाइम पर 2014 में अमेरिका में एक नई दवाई पता चली थी जो कैंसर को ट्रीट करने के लिए इस्तेमाल होना शुरू हुई, and that was called immunotherapy. So what does immunotherapy exactly do? So this is definitely the new kid on the block. So immunotherapy आपकी बॉडी के खुद के इम्यून सेल्स को, जो आपके CD4 T सेल्स होते हैं, उनको कैंसर से लड़ने के लिए दोबारा से तैयार करता है. So होता क्या है कि कैंसर हमारी बॉडी में एक फॉरेन ऑब्जेक्ट की तरह बिहेव करता है. हमारी बॉडी की इम्यूनिटी को हर फॉरेन ऑब्जेक्ट को निकालना चाहिए. आपको नज़ला जुकाम होता है, आप खांसते हो, छींकते हो, दैट इज योर बॉडीज डिफेंस, योर इम्यूनिटी ट्राइंग टू फ्लश आउट द टॉक्सिन फ्रॉम योर बॉडी. आप कुछ गलत खा लेते हो, गड़बड़ खा लेते हो, आपका पेट खराब हो जाता है. इसलिए योर बॉडी इम्यूनिटी इज फ्लशिंग आउट द टॉक्सिन फ्रॉम योर गट. आपको डायरिया होता है, वॉमिटिंग होती है, योर बॉडी इम्यून सेल्स डोंट वांट दैट टॉक्सिन इनसाइड, वो उसको बाहर निकालता है. सिमिलरली जब कैंसर हमारी बॉडी में फॉर्म होना शुरू होता है, तो हमारे इम्यून सेल्स को उस कैंसर को बाहर निकालना चाहिए. बट कैंसर बहुत चालाक होता है. कैंसर अपने आप को डिस्गाइज कर लेता है, अपने ऊपर एक क्लोक, एक चादर ओढ़ लेता है, और हमारे कैंसर से हमारे बॉडी के इम्यून सेल्स उस कैंसर सेल को पहचान नहीं पाते. तो इम्यूनोथेरेपी क्या करती है, वो आती है और कैंसर सेल्स के ऊपर से वो नकाब, वो मास्क हटाती है, और हमारे टी सेल्स कहते हैं कि तुम्हारे दुश्मन है ये तुमको बुद्धू बना रहे हैं, इनको मारो. And our body's own immunity then starts to recognize the cancer cells and starts to kill them. So your body's own immunity जो अब तक सो गई है, it suddenly becomes more active and it starts to kill the cancer cells. So 2014 में जिमी कार्टर जो कि अमेरिकन के एक्स प्रेसिडेंट थे, उनको ये इम्यूनोथेरेपी दी गई, and within a matter of few months उनकी बॉडी से कैंसर गायब हो गया. So much so कि उनकी ब्रेन का कैंसर भी दिखना बंद हो गया. And he stayed like that in remission for the next 8 years of his life. 2022 में जब वो 100 साल के होने वाले थे, जिमी कार्टर ने बोला कि I don't want any treatment, I want to go for hospice care, and he went into a hospice जहाँ पे आपको old age home से ज़्यादा सिर्फ care, comfort and palliation दिया जाता है. And he remained there till his death about 3-4 months back in 2025, when he died at the age of 100. Yet he did not die of cancer. He died of old age. That is the power of immunotherapy. Our very own Yuvraj Singh, anybody knows this story? Which cancer was Yuvraj Singh suffering from? No, not of that cancer. Someone said lung. Who said lung? Okay, so it was not a lung cancer per se, but it was a cancer in the space between the lungs. हमारे राइट लंग और लेफ्ट लंग के बीच में जो चेस्ट की जगह होती है उसे मीडियास्टिनम कहते हैं, मिड लाइन में मीडियास्टिनम. तो he had a cancer in the mediastinum called a germ cell tumor. आमतौर पर ये germ cell tumor arises in the testes in the males and ovaries in the females. It arises from the sexual cells of the body. But these cells can also be found in other areas of the body like the chest. So Yuvraj Singh had a mediastinal germ cell tumor, एक ball की shape में tumor हो गया था, and by the time he was being declared the man of the series in the 2011 World Cup में India जीता था धोनी की कप्तानी में, Yuvraj Singh was the man of the series. He was actually vomiting blood every day in the dressing room and playing sterling knocks for his country. After that he got diagnosed. And you know कि जो युवराज सिंह को कैंसर ट्रीटमेंट मिला उसने एक किताब में लिखा है, अगर वो इंडिया में ट्रीटमेंट लेता तो उसकी एक साइकिल की क्या कॉस्ट थी? Take a rough calculation. Anybody can give me an answer. Anybody. अगर वो एक साइकिल इंडिया में लेता तो उसके उस कैंसर ट्रीटमेंट का इंडिया में खर्चा 10-15 हज़ार से ज़्यादा का नहीं आता. He went to the US basically to take that treatment of chemotherapy just to avoid the media glare and the paparazzi, because in India there is a lack of privacy and our press just doesn't let celebrities or anybody in the public life to have any privacy in their own matters. So Yuvraj Singh went to the US, he took chemotherapy, he became alright, he came back and started playing for India again, he got married and he had a child, and today 15 years later he is cancer free. तो आज की डेट में भी ऐसा नहीं है कि कीमोथेरेपी काम नहीं करती. For certain tumors, chemotherapy still plays a wonderfully spectacular role of having achieved a cure 15 years down the line. हमारे बहुत सारे पेशेंट्स को कैंसर के ट्रीटमेंट के दौरान बाल जाने का खतरा होता है. So today we have a new invention called a cool cap. ये cool cap क्या है? Can you see this lady is actually wearing a cap on her head. इसकी कीमो चल रही है. She's actually wearing cool gloves also, जो एकदम mittens की तरह है. And she's actually sucking on ice cubes so as to cool her oral cavity. तो हमने उसके स्कैल्प को ठंडा कर दिया. इस वाले कैप में एक जेल होता है. We connect this cap to a machine and this gel जैसे वो आइसक्रीम के जेलों में कोल्ड नहीं होता, आइस पैक्स होते हैं, तो वैसा जेल होता है कि आपके स्कैल्प को 15 से 20 डिग्री के सेल्सियस के टेम्परेचर पे ले आता है, ठंडा कर देता है. उसकी वजह से क्या होता है कि आपके हेयर फॉलिकल्स को ब्लड सप्लाई कम मिलती है, और जब आपके बालों में ब्लड सप्लाई कम जाएगी तो कीमोथेरेपी जो आपको दी जा रही है उसका भी एडमिनिस्ट्रेशन आपके बालों तक कम जाएगा, एंड हेयर लॉस इज अराउंड 20 to 25% लेस एज कम्पेयर टू समवन जिसको हमने कूल कैप नहीं दिया. हम ये कूल मिटन्स लगाते हैं हाथों में ताकि हमारी कीमोथेरेपी से हाथों की और पैरों की नर्व्स को डैमेज ना हो, जिसको न्यूरोपैथी कहते हैं. कई बार लोग कीमोथेरेपी की बात कहते हैं कि हमारी नसें कमजोर हो गई, उंगलियां झंझनाहट रहती है, उंगलियों में टिंगलिंग सेंसेशन रहता है, हम चमचा नहीं पकड़ सकते, बटन नहीं लगा सकते. सो नर्व्स को डैमेज ना हो, हम हाथों को ठंडा रखते हैं. एंड मुंह में कीमोथेरेपी से छाले ना हो तो हम पेशेंट्स को आइस क्यूब देते हैं ताकि ओरल कैविटी को भी ब्लड सर्कुलेशन कम मिले ड्यूरिंग कीमो, और उससे ओरल कैविटी में छाले होने के चांसेस कम रहते हैं. So these are the newer technologies that are helping us to decrease and reduce the side effects of chemotherapy जिससे कि लोग डरते हैं. These are some injections जो कि हमारे ब्लड के WBC काउंट एंड प्लेटलेट काउंट को इंप्रूव करने के लिए हम पेशेंट्स को देते हैं जो कीमोथेरेपी से लेगा सप्रेस हो सकते हैं. So what are the key takeaways of today's health awareness talk? That cancer is not treated only with chemotherapy in the 21st century. Acceptance within the medical fraternity and the general public at large is very important for these effective tools for cancer treatment. अगर हमें आज पता नहीं होगा तो हम उसके बारे में सवाल नहीं पूछेंगे. Awareness within the patients and general public that cancer is not treated only by chemo, and mind you, cancer does not always mean a death sentence. Rationalizing the cost of treatment is very important because आज की डेट में भी बहुत सारी treatments are very costly. आपको cost के बारे में हमसे better जानते हो. You study the economics and the financial aspects of various products. So it is necessary to widen the drugs and make them reach the last person standing in the line उसके लिए ट्रीटमेंट की ज़रूरत है. And very importantly, our government and private insurance companies must cover the cost of genetic testing as well as these newer modalities of treatment so that these treatments can become commonplace और ज़्यादा से ज़्यादा लोगों को इसका फ़ायदा हो सके. Because अगर हम ये तकनीक, ये टेक्नोलॉजी, ये ट्रीटमेंट्स पेशेंट्स तक पहुँचा पाए, तभी हम only then will we be able to offer them hope. Thank you very much. Throw the floor open for any questions and answers, and feel free to ask anybody. Just raise your hand and let me know if you have any questions. Anybody amongst the students, staff, anyone? Yes, ma'am. Tell me. What's your name?
Shivani. Shivani.
Shivani. Yes. What's your question?
My question is, sir, why is it brain tumor and everywhere it is cancer?
Okay, so tumor basically only means any growth in the body. That tumor can be cancerous or it can be non-cancerous. Tumor जो है वो दो नहीं हो सकता है. So brain में बहुत सारे जो ट्यूमर होते हैं, tumor is any growth. तो अगर मैं कहूँ कि ओवेरियन ट्यूमर है, तो जरूरी नहीं है कि वो कैंसर है. बहुत सारे ओवेरियन ट्यूमर्स नॉन-कैंसरस हो सकते हैं. बहुत सारे ब्रेन के ट्यूमर्स नॉन-कैंसरस हो सकते हैं. जैसे कि बहुत कॉमन ब्रेन ट्यूमर है मेनिंजियोमा, जो हमारी ब्रेन की सरफेसेस होती हैं, जिसको हमारी ब्रेन को कवर करते हैं, उसको मेनिंजेस कहते हैं. उन मेनिंजेस में अगर कोई ट्यूमर या ग्रोथ डेवलप हो या एब्नॉर्मल कलेक्शन ऑफ सेल्स डेवलप हो और हम सर्जिकली उसको निकालें, तो सर्जरी ही उसका आंसर है. तो आपको कोई कीमो या कोई और ट्रीटमेंट की जरूरत नहीं होती, बिकॉज वो नॉन कैंसरस है. सो ट्यूमर जस्ट मीन्स अ कलेक्शन ऑफ एब्नॉर्मल सेल्स. दोज एब्नॉर्मल सेल्स समटाइम्स कैन बी कैंसरस and many of the times they are non-cancerous. So tumor can be any abnormal growth in your body. Anyone else? Yes ma'am, at the back. मतलब girls को questions ज़्यादा आते हैं, boys को answer ज़्यादा. Yes ma'am, tell me, what's your name? Anjali. Yes, what's your question ma'am? I can't hear you from here, so let me come to you. Yeah. Okay, so Anjali has asked me a very pertinent question कि कोई भी सेल्स हमारी बॉडी में एब्नॉर्मल ग्रोथ क्यों करते हैं. So effectively, simply speaking, ये कैंसर होता ही क्यों. So इसके बहुत सारे कारण हैं. बेसिकली कैंसर एक एजिंग प्रोसेस की वजह से होता है. हमारे सेल्स जब डिवाइड करते हैं, हमारी बॉडी के हर सेल का एक लाइफ स्पैन होता है. आपके रेड ब्लड सेल्स, आपके वाइट ब्लड सेल्स, आपकी प्लेटलेट्स, आपके स्किन के सेल्स, आपके नाखून, आपकी बॉडी का हर सेल एक पर्टिकुलर लाइफ के लिए जीता है और फिर उसकी जगह नए सेल्स आ जाते हैं और पुराना सेल मर जाता है. ड्यूरिंग दिस एक्टिव डिवीजन कई बार हमारे सेल्स के अंदर जेनेटिक डैमेज करेक्ट होता रहता है. कुछ जेनेटिक डैमेज हमारी बॉडी रेक्टिफाई करने के मैकेनिज्म रखती है, लेकिन अगर ओवर अ पीरियड ऑफ टाइम जेनेटिक डैमेज ड्यूरिंग द प्रोसेस ऑफ डीएनए रिपेयर एंड ड्यूरिंग द प्रोसेस ऑफ सेल डिवीजन अक्यूमुलेट होता रहे और उसका रिपेयर ना हो पाए, इवेंचुअली वो जाके एक कैंसर सेल का रूप ले लेता है. इट्स लाइक सेइंग, एक गाड़ी बनाने की फैक्ट्री में एक जगह पर गाड़ी के व्हील्स बन रहे हैं, एक जगह पे गाड़ी की बॉडी बन रही है, एक जगह इंजन बन रहा है, एक जगह दरवाजे बन रहे हैं और सबको ला के उसको जोड़ा जा रहा है. और जब वो गाड़ी बाहर आ रही है तो वहाँ पे एक पुलिसमैन, एक इंस्पेक्टर खड़ा है जो ये इंश्योर करता है कि ये गाड़ी पुरानी गाड़ियों की तरह एकदम क्वालिटी में बिल्कुल बढ़िया है, हमारे पुराने मॉडल्स की तरह. यही आपके सेल्स का डीएनए नया बनने का तरीका है. कहीं से प्रोटीन आएगा, कहीं से न्यूक्लिक एसिड्स आएंगे, उनको जोड़ के आपके नए सेल का डीएनए बनाया जाएगा. अब अगर उस गाड़ी के बनने में कोई डिफेक्टिव पार्ट आ जाए, गाड़ी का दरवाज़ा खराब, गाड़ी का इंजन वीक है, गाड़ी के हेडलैम्प काम नहीं कर रहे, तो वो जो इंस्पेक्टर वहाँ खड़ा है वो कहेगा ये डिफेक्टिव पीस है, इसको हटाओ, दूसरा लाओ, वरना मार्केट में गाड़ी जाएगी तो हमारी बदनामी होगी. और अगर बहुत सारी गाड़ियाँ ऐसे चली गई तो हमारी तो कंपनी को दे देगा. अगर हमारे उस डीएनए रिपेयर प्रोसेस को, ये जो पुलिस इंस्पेक्टर खड़ा हुआ है जो कि गाड़ी के पार्ट्स को चेक कर रहा है, अगर हमारा वो मैकेनिज्म खराब हो जाए जो डीएनए को रिपेयर करने का काम करता है, कि कहीं भी डीएनए खराब बने, वो बोले कि इसको तोड़ो, दोबारा बनाओ, ये खराब है, तो अगर वो ऐसा ना कर पाए तो हमारे बॉडी में जेनेटिक डैमेज अक्यूमुलेट होता रहेगा. मार्केट में खराब गाड़ियाँ जाती रहेंगी और एक दिन वो आएगा जब मार्केट में सारी खराब गाड़ियाँ होंगी और आप उस कंपनी की गाड़ी नहीं लोगे. तो अगर इस तरीके के बहुत सारे सेल्स जिसमें वो सेम जेनेटिक डैमेज अक्यूमुलेट कर जाए, that results in the formation of a cancer. This is one theory. Then some cancers are hereditary. जैसे मैंने बताया 8 to 10% of cancers are hereditary because of an inherited genetic problem that you may have inherited either from your mother or from your father. Number 3, and very important for all you young people out here, lifestyle, smoking, alcohol, tobacco, पान मसाला, खैनी, गुटखा, ये सब हमारी बॉडी में जेनेटिक डैमेज ही तो करता है जो इवेंचुअली जाके कैंसर में तब्दील हो जाता है। एक बड़ा अच्छा क्विज आया था, आई टेल यू दिस वेरी इंटरेस्टिंग स्टोरी। एक क्विज में एक चेयर दिखाई गई, उस चेयर पे एक सिगरेट का पैकेट रखा था, एक टोबैको का पैकेट रखा था, पान मसाला, और एक शराब की बोतल रखी थी। और लोगों से पूछा गया विच इज द मोस्ट रिस्की हेल्थ हैजर्ड अमंग्स दीज ऑब्जेक्ट्स दैट यू सी इन द पिक्चर। सो वुड यू एनीवन इफ यू लाइक टू टेक एन आंसर? ये सबसे खतरनाक कौन है? एनीबॉडी? सिगरेट, ओके। एनीवन एल्स? एनीवन एल्स? पान मसाला कहा मैडम ने। एनीवन एल्स? अल्कोहल बची, कोई अल्कोहल बोल दो। वंडरफुल आंसर, आई थिंक ही डिजर्व्स अ ग्रेट राउंड ऑफ अप्लॉज। उस पिक्चर में सबसे खतरनाक चीज है कुर्सी। यस, एंड सिटिंग इज द न्यू स्मोकिंग। ओबेसिटी यानी ओवरवेट होना, वजन का बढ़ना has been linked to a multitude of cancers: breast cancer, colon cancer, uterus cancer, intestine cancer, and many other, liver cancer. All of them have been linked to what he said. What's your name, sir? Manu. He's given the best answer of the day. Okay, so that sedentary lifestyle and obesity is the most risky habit that you can virtually adopt. And therefore, lifestyle is a major factor that plays a role in the causation of cancer. So great answer, Manu, really appreciate it. And all the lectures that I've gone to, you perhaps the first one was given the answer, that the chair is the most risky of the all. Anybody else? Yes, ma'am, tell me.
Sir, can radiation therapy help to cure the brain?
Can radiation therapy?
Cure the brain.
Yes. So actually brain में हमारे ब्लड और ब्रेन के बीच में एक बैरियर होता है जिसको हम बोलते हैं ब्लड ब्रेन बैरियर। हमारी बहुत सारी कीमोथेरेपी की दवाइयाँ इस ब्लड ब्रेन बैरियर को क्रॉस नहीं कर पाती हैं बिकॉज दिस इज फॉर आवर बॉडीज ओन प्रोटेक्शन। इसलिए ब्रेन में अगर कोई ट्यूमर होता है या कोई कैंसर होता है तो उसका मेन इलाज सर्जरी और उसके बाद उस एरिया को रेडिएशन देने से होता है ताकि वहाँ पे कैंसर वापस ना आ सके। कीमोथेरेपी भी उसमें यूज की जाती है बट वो हमारे बाद की बात है। मेन इलाज फॉर मोस्ट ऑफ द ब्रेन ट्यूमर्स इज सर्जरी, सर्जिकल रिमूवल ऑफ द कैंसर एंड गिविंग इट टाइप ऑफ एक्सरेज, जिसको हम रेडिएशन थेरेपी कहते हैं, ताकि बचे कुछ एरिया को हम सैनिटाइज कर सकें और वहाँ पे कैंसर सेल्स को खत्म कर सकें। बिकॉज ब्रेन में कई बार हम कैंसर को पूरा निकाल नहीं पाते। बिकॉज मान लो जहाँ पर ब्रेन में कोई कैंसर है उसके आसपास हमारे ब्रेन के कुछ इंपॉर्टेंट स्ट्रक्चर्स होते हैं जिनको निकालने से हो सकता है हमारी बॉडी की कोई फंक्शनिंग पे अफेक्ट पड़े। तो इसलिए डॉक्टर्स सर्जन्स उतना ही ट्यूमर निकाल पाते हैं जितना प्रैक्टिकली उस पेशेंट की लाइफ के लिए सेफ है और उसके लिए अपनी नॉर्मल जिंदगी जीने के लिए अलाउड है। अगर ज़्यादा एग्रेसिव सर्जरी करी हो कोई इंपॉर्टेंट ब्रेन का स्ट्रक्चर डैमेज हुआ तो दैट पर्सन कैन बी पैरालाइज्ड फॉर लाइफ। तो इसलिए ज़्यादातर ट्यूमर को हम सर्जिकली निकालते हैं और जो माइक्रोस्कोपिक बचा कुचा रह जाता है उसको रेडिएशन से किल करते हैं। Any more questions? Yes, ma'am. Okay. So chemotherapy basically works on actively dividing cells. हमारे जो कैंसर सेल्स हैं they divide very fast, बहुत तेज डिवाइड करते हैं और इनको डिवाइड करने के दौरान अगर इसके ऊपर कोई प्रहार करे तो ये अपने डिवीजन के दौरान सबसे ज़्यादा वल्नरेबल होते हैं मरने के लिए। अगर कोई कैंसर सेल चुपचाप छूट के बैठ जाए, डिवाइड ना करे, कहीं जाके छूट जाए, कहीं गुफा में छूट जाए तो वो आदमी छुपा रहेगा, पर जो बाहर आएगा वही हमारी कीमोथेरेपी की चपेट में आता है। So chemotherapy actually kills these actively dividing cells either by inhibiting their cell division or by preventing the substrates to be provided to cancer cells which are required for their cell division. तो या तो जो उनके लिए बनने के लिए प्रोडक्ट्स चाहिए, फोलिक एसिड, DNA, जो कि हमारे कैंसर सेल्स को बनाने के में इंपॉर्टेंट पार्ट प्ले करते हैं, उनकी सप्लाई को हमारी कीमोथेरेपी बंद कर दी एंटी मेटाबोलाइट तरीके से या डायरेक्टली कैंसर को मार सकती है। बट कीमोथेरेपी हमारे नॉर्मल सेल्स पर भी ऐसा इफेक्ट करती है। That is why chemotherapy does not only kill the cancer cells, it also kills our normally dividing cells. Any more questions? So, thank you very much. You've been a great and supportive audience, and I really appreciate you taking time out from your busy schedules to attend this awareness lecture. And I hope I've been able to contribute a little bit of my own self to tell you the kind of times that we are living in, and I hope I've contributed to your understanding of cancer, and I hope that each and every one of you will go out of this hall today far more richer and far more sorted in terms of your understanding of cancer, and will spread this awareness in the community at large. Thank you. Yes, ma'am.
Let us carry forward today's learning with awareness, responsibility and purpose.